678,290,000 kids under 5 around the world. But what's so important about being 5? Well, children who live to age 5 are twice as likely to reach adulthood. That's why vaccines matter so much. For 40 years, Rotary and partners have delivered vaccines globally. Like here and even here, in your neighborhood and around the world, Rotary is ensuring children grow up safe from preventable diseases.
Sawadika. Welcome to Creating Magic with Rotary, a monthly live talk that dives into the inspiring world of Rotary service projects. We are simultaneously streaming on Suthichai Live, Mojo Club, and Rotary channels in 7 Southeast Asia countries or cities. My name is Supan Wiboonma, your moderator. Feel free to post your questions, comments, feedback to improve our show, and do let us know from which country you are watching this show. October 24th is World Polio Day, a global day to raise awareness and resources for the worldwide effort to eradicate polio. Thank you for joining us in this episode on United Against Polio, Rotary's Global Partnership. It is indeed my honor to welcome to our show 2 prominent representatives from Rotary, which is one of the 6 key organizations spearheading the GPEI, or Global Polio Eradication Initiatives, a public-private partnership with the one common goal, that is to eradicate polio worldwide. First, Mr. Andre Suharto, Rotary's Regional End Polio Now Coordinator. He's also Rotary International's past District 3310 Governor, a very active member of Rotary Club of Kuching Central in Malaysia. Hello, Andre.
Sawadika, how are you? Thank you for having me.
Sawadika. And Mr. Frank Chuen Chan, Chair of Fundraising and Community Corps, and a very dedicated club president of the Rotary Club of Kwai Chung in District 3450, Hong Kong. Hello, Frank.
Hello, Supan. Thanks for having me.
Sawadika. Well, can you two please introduce yourself a little bit more, starting first with Andre.
Oh, thank you very much. First of all, thank you for the kind invitation for me to be invited into this particular session in conjunction with the World Polio Day. I have been appointed by Rotary International to look after the activities of, number 1, creating awareness of polio eradication in our region for the year 2023 until 2026. And number 2, the second objective is to help raise funds that we can actually remit to Rotary International for them to continue the polio eradication initiatives. And the region that I cover basically comprises of Singapore, Malaysia, Brunei, Thailand, and all the Indochina countries that include Laos, Cambodia, Myanmar, and Vietnam. And it is my honor to be here this particular session. Over to you.
Thank you, Andre. Can you introduce yourself a little bit more to the audience, Frank?
Yes, Supan. Well, I'm Frank Chen, and I'm a food manufacturer based in Hong Kong. I joined the Rotary in 2010, and I currently serve as the Rotary Foundation fundraising chair for our district. It's a pleasure to be here today to share our efforts in fundraising for polio eradication across Hong Kong, Macau, and Mongolia. Back to you, Supan. Thank you.
Cool. Before we talk into the detail of polio, Andre, would you please educate or advocate us to understand more of polio? So, what is polio and its symptoms?
Okay, before I continue with that definitions and to answer your questions, I just want to let you know that the countries that are added to my responsibility effective 1st of July this year includes Hong Kong, Mongolia, China, and Macau. And that's the reason why I'm very happy to have Frank with us this webinar. Thank you, Frank, for being here.
Thank you.
Wow, amazing. Wow.
Now, polio, not
Polio.
many people actually know about polio, because you know why? In this region of ours, every newborn are very fortunate to have been vaccinated against polio. It is actually a virus, and the official name is called poliomyelitis. And it basically attacks children who are below 5 years old and can cause paralysis and even death to some instance. And that is the reason why I think we got to be very, very careful about this particular disease of polio to ensure that it will never come back to where we live. Just because we haven't got polio, it doesn't mean that it will not be able to come back. I hope that explains in layman terms, because I'm not a doctor. I'm not a medical doctor. I'm actually a businessman, and Rotary is actually my pastime activities. Over to you.
Is it easily transmitted, and what would be the risks?
Very good question. Thank you for asking that question. Transmission is basically through feces, the human feces. That means if somebody has got polio and the feces are going around through openly because of poor sanitation, and somebody happened to touch the contaminated either sand or earth or any objects contaminated by the feces that carries the virus, and they never wash their hands, and they touch on the food and they take the food, the virus will go into the gut, into the intestine. And that is when it will attack the nervous system, that will cause paralysis. So that is how it is being transmitted, through poor sanitations and hygiene. These are the two key factors.
Wow. Can it be cured at all?
You know, the worst part about this polio virus is that it cannot be cured, but it is preventable. So we must learn how to make sure that we can prevent it from coming back, because once a person or a child contracted this virus, there is no cure. And we will not want to have small children being paralyzed and crippled, because this will actually just, make their future very bleak. Over to you.
Now, I have been told that Rotary and many organizations joins hand in establishing GPEI. Can you please elaborate how this public, private, and civil society partnership takes place, and what is Rotary's role in this partnership?
Okay, thank you. Not many people knows about this organization called GPEI. Actually, the one that started polio activity is Rotary International. It goes back as far as 1979, when Rotary conducted a polio immunization activity in the city of Makati in Philippines. And that was the start in 1979. That was the start of a multi-year project to immunize 6 million children in the Philippines against polio. And then what happened is that from 1979, 6 million children, yes. And 6 years later, in 1985, Rotary International decided to set up a fundraising initiative, which they call it Polio Plus. And this Polio Plus was launched in 1985 with a fundraising target of 120 million US dollars. And subsequent to that, 3 years later, the World Health Organization actually had their assembly. And in that assembly, they passed a resolution to eradicate polio. And Rotary played a significant and complementary role in the assembly works towards the milestone in the eradication of polio. And in the same year, they set up GPEI, which stands for Global Polio Eradication Initiative. And the members of this GPEI, at that point in time when they first started, were only 5, namely World Health Organization, and then you have UNICEF, which stands for United Nations Children's Fund. And then, and why UNICEF? Because this polio virus affects children below 5. So that's why UNICEF came into the picture. And then we have CDC. CDC is the US Center for Disease Control and Prevention. And then we have Rotary, and last but not least, the 5th partner was Bill and Melinda Gates Foundation. And what happened is that from 1988, when it was set up, until 2019, the 6th partner came in, and that partner is called GAVI, G-A-V-I. Basically, they are Global Vaccine Alliance. And their objective is to make sure that vaccines are accessible to all countries, especially those who do not have the means to buy them. So those are the 6 members as of today of GPEI. And at that time when they set it up in 1988, I think they had about 350,000 polio cases. So in 125 countries. And today, we have eradicated 99.9% of polio around the world. I hope that gives a little bit of information of this GPEI, who play a very important role in the global polio eradication. Over to you.
Thank you. You mentioned Bill and Melinda Gates Foundation. What contribution have this foundation brought into the program with Rotary and GPEI?
Okay. Thanks for asking that question, because a lot of people do not understand that among the 6 partners in GPEI, each one of them plays different and complementary roles. Bill and Melinda Gates Foundation, as an example, they actually contribute to technical and financial resources to accelerate targeted vaccination campaign, community mobilizations, and routine immunizations. They also work with partners to improve polio surveillance and outbreak response. And they also develop safer and more effective vaccines. So these are one of their responsibilities. And in 2007 November, they collaborated with Rotary International in fundraising, where every dollar raised by Rotary and Rotary members, they will match $2, up to a maximum of 100 million US dollars in any one year. And since then, in 2007 until today, Rotary members have been encouraged to do fundraising, so that the idea is we can raise 50 million US dollars, and the Bill and Melinda Gates Foundation will double that to become 100 million, because that's the maximum that they are willing to match. So 100 million from Bill and Melinda Gates plus 50 million from Rotary members, total up 150 million US dollars. So that is the kind of collaboration that we have been having between Rotary International and the Bill and Melinda Gates Foundation. Over to you.
Andre, you mentioned that it leaves us 0.01% to be eradicated. What are our remaining challenges?
Oh, I tell you, there are so many challenges today. As an example, lately we have a lot of conflicts in the world. As an example, in Gaza, because of the war going on in there, sanitation is actually at risk and has been compromised. And lack of water. Children cannot wash their hands. Sanitation is a problem. There is no clean, well, not say there is no clean toilet, but the number of clean toilet is very, very small number. So you can imagine the feces are scattered around. And then when they are dried up, they are actually absorbed with the sand or with the earth. And imagine the small little children playing around the compound, in whatever area that they can actually play. And then they forgot or they don't even have enough water to wash their hands. And then that's when the virus actually get transmitted. So this is one of the challenges that we have with why currently the virus is still going on. And the other part is that we have some section of the community who do not believe in vaccination. I'm not too sure whether you recall when we had COVID-19, there are sections of the community who do not want to be vaccinated because they don't believe in vaccine. Right. And so this is one of the challenges. And the other challenges is going to remote places to vaccinate the children. And it is not easy because they are in the interior. And therefore, during the immunization process, some of our volunteers could have missed some children from being vaccinated. And this is one of the challenges. Of course, we are trying to improve every year, but basically, these are some of the key challenges facing us that is preventing us, or not said preventing, but making the achievement of zero polio stretching a bit longer than we anticipated.
I see. So I think this is why all Rotary clubs in the world are called to join hands, involved in polio eradication, and to make a difference. Can you describe how these Rotary clubs are joining the program?
Okay, what happened is that today every Rotary member has been encouraged to contribute some money, right? Either from their own pocket or they do have an innovative way of doing fundraising, which I think Frank will be able to share with us the kind of fundraising that they have been doing very successfully. And they raised a lot of money last year. So, because, as Rotary members, imagine since 1985 until today, we have been doing fundraising. So the challenge is that a lot of Rotary members get very fatigued and tired, in doing fundraising. So we need to be innovative. We need to educate them because the challenge, the failure of us doing fundraising and not contributing to this polio eradication will be disastrous. The result will be so big that it is not worth for us to be complacent. In fact, World Health Organization is saying that once we stop doing the fundraising and they don't have enough funds, we're talking about 200,000 infected children, 200,000 coming back immediately for polio being infected onto their bodies. So this is something that we need to look at.
Wow. Well, with this perspective, may we include Frank in the conversation? Frank, you are in Hong Kong. Polio seems like a distant issue in Southeast Asia, including Hong Kong. Yet you have been quite successful in raising funds for polio eradication over the past years. Can you please describe how this is possible?
Yeah, well, as Andre has mentioned, Polio may not be a prevalent issue in Hong Kong, Macau, and Mongolia, where the last recorded cases were in the early 80s for Hong Kong and Macau, and 1993 for Mongolia. Many young people are not fully aware of what the disease is about. However, we recognize that until polio is completely eradicated, all countries remain at risk of imported wild polio virus, as has been seen in several nations. This makes eradicating polio a worldwide effort. Over the past years, our district has managed to raise over 100,000 US, and last year we even raised over 200,000. And our commitment stems for the belief that every contribution counts in the fight against polio, while inspiring others to join our cause. Over to you, Supan.
Wow, when you say you've been doing campaign, can you describe what sort of activities that have been organized or you plan to organize in the near future for the fundraising or activities that raise awareness in Hong Kong?
Right. Each year we organize various fundraising events, such as the World's Greatest Meal, where a portion of the meal fee is donated to the End Polio Fund. However, our signature activity is the End Polio Walk, which has been carried out in all three areas, Hong Kong, Macau, and Mongolia. Each year we select a scenic site for the charity walk, and Rotary Clubs contribute from $800 to $1,600 US to participate. We invite professionals to speak about polio and its impacts. And we also features a performance from local singers, making it an enjoyable day for everyone involved. I'm glad to see that last year we began to invite the public to participate as well, not just Rotarians. And we typically have over 1,000 participants each year. Another important aspect of the walk is its public image. Well, press coverage helps us spread the message of polio eradication more effectively. Over to you, Supan.
You mentioned 3 locations, Hong Kong, Mongolia, and
Macau.
Macau. Yeah, how successful in terms of your objectives in figures or in terms of participation from public or any other partners you brought in?
We're seeing more and more. It used to be just Rotarians. We're starting to get publics to involve as well from last year. And we're keeping up. Just like Andres mentioned just now, people get fatigued. And so as the Rotarians here in my district, people might think that every year we're talking about how close we are to polio eradication, but it just seems like it's just not there. So it's like a never-ending effort. So but I think we've been quite successful in raising the awareness and letting people know the importance of keep going. And yeah, this is what we're going to continue to strive for in the future years.
Wow. Well, and then what have been the challenges in raising funds for this cause, Frank?
Well, while our fundraising efforts have been successful, we do encounter several challenges. One significant hurdle is raising awareness about polio itself. As I said just now, many young people today are unfamiliar with the disease. The lack of awareness makes it difficult to convey the urgency of our eradication efforts. Another challenge is the need to secure sufficient funds to organize our events. The cost of associated with organizing activities like the End Polio Walk can be significant. To help cover these expenses, we sell T-shirts and souvenirs, but it can sometimes be difficult to generate enough revenue for these sales. Well, additionally, many potential donors may have other charitable causes they are passionate about, which can dilute their attention and resources. It's crucial for us to effectively communicate the critical needs for polio eradication and to stand out among various social issues that our community is engaged in. Despite these challenges, we are committed to our mission. Each obstacle we face provides an opportunities for growth and creativities, and we continue to explore new ways to engage our community and raise funds for the vital cause.
Great, keep going. Andre, you're the Rotary's Regional and Polio Now Coordinator, and you just mentioned that started July this year. You add your responsibility covers Hong Kong, Malaysia, and Macau. Are there words to add on what Frank reported on his program or campaign in Hong Kong, Macau, and
China is included as
Mongolia.
well, and Mongolia, yes. And like what Frank is
China
saying,
as well,
correct.
Uh-huh.
And what Frank has actually shared with us earlier on. Basically, polio is non-existent in those countries. So the challenge is, how do you get people to contribute money when they do not know about polio? So I think the first thing that we need to do, like what Frank has actually been doing in those countries that he is actually responsible for, is to educate members of the public and the community about polio. And then only they will be able to contribute some money, because they will feel that they are part of the solution in order to prevent polio from not being able to come back to those countries. I give you an example. I live in Malaysia, and Malaysia has been declared polio free for many, many years. But in 2019, one part of Malaysia, one of the states on the east coast, not on the east coast, sorry, on the eastern Malaysia side of the state of Sabah, there was a child who contracted polio. And that was the time when everybody suddenly had a wake-up call, including Rotary members, because for those who have been so confidently thinking that polio will never come back, suddenly their belief was proven wrong. And today, Indonesia is having a recurrence of polio as recent as June this year. And Indonesia is very near to where we are. Yes, in Indonesia. And with the number of people flying, I'm sure you know that today the cost of air tickets have gone up because so many people are flying. And I'm just worried that the transmission of the virus will make it easier to go from place to face, from places to place. And so I think it is in the responsibility of everyone to make sure that we continue to educate members of the public about polio, and that there are vaccines available to prevent children or people from getting polio, and that it costs money to bring in this vaccine. To talk about money, some people thought that whoever invented polio vaccine, some people are thinking that they are making millions of money, or billions of dollars. Actually, it is not. There were two inventors of polio vaccine. The earlier part was in 1950 by Jonas Salk, and he is actually from America. And when he developed what they call it the inactivated polio vaccine, IPV, this contained the killed virus being injected into human being. And he decided that he doesn't want to get any royalties. And it was given free for manufacturers to produce it. But this inactivated polio vaccine requires professional medical people to give injection, to administer it, because you got to use injection. So you need a syringe and a needle to actually inject through either the arm or the leg of a person. Until the late 50s, when another physician and microbiologist by the name of Albert Sabin came up with what they call it oral polio vaccine, OPV. Again, he has actually done it and commercialized it without any royalty. And today, Rotary has been using the oral polio vaccine, or rather the GPEI, not Rotary, yeah? GPEI have been using the oral polio vaccine because, number one, it's easy to administer. You just take, anybody can do it, just give the drops, 2 drops of the oral polio vaccine onto the small children. And that's about it. You do it at least 2 times over a 1-month interval. And that's what they are doing in Gaza. They did it on the 1st of September, and then they're supposed to do it again the second time on the 14th of October for about 590,000 children in Gaza. And so what happened is that this oral polio vaccine has been effective. But subsequently, they found out that if a child has taken the oral polio vaccine, because I mentioned earlier on that this vaccine actually is transmitted through the feces. The virus actually thrives in the feces of human being.
Yeah.
This oral polio vaccine goes into the digestive system of a person or the children, and the intestine and the gut becomes actually sterilized. All right? So when a person or a child who has received the OPV and their feces got contaminated, because of poor sanitation, the feces went throughout the community in an open air. And when children actually take them, right, not literally taking them, but when their hands are contaminated with the feces of these people, then what happened is that virus, or rather that particular OPV, right, gets injected into the gut. Now, it was found out that over a period of time, this weakened virus, because the OPV contains weakened virus, whereas the IPV contains the killed virus. The weakened virus, they can mutate, and then the people who got infected got this, what they call it, a circulated vaccine-derived polio virus. And this is what is happening in Indonesia, and as well as in Malaysia in 2019, and in many other parts, right? So this is very important. But today, they have come up with another polio drops. They call it the novel polio drops. And they are using that because this one is more effective because it doesn't mutate. And I hope that with the breakthrough, and this is again through research, and research needs money, right? We hope that with this novel polio virus, the situation will get better. I hope that explains. I'm not a medical doctor, but I'm trying to explain in layman terms.
I was about to ask the importance of continued support, but you already mentioned that in your conversation. Now, let me know, Andre, how many children, approximately how many children in a year are receiving polio vaccine?
I don't have the figures, but I know in Gaza, as I mentioned, on the 14th of October, they are going to vaccinate 590,000 children. On the 1st of September, when they did it for the very first time, when they did it in Gaza, I think they were doing it for about 509,000, around that number. It falls short, or rather it fell short of their target. Their target was 640,000, but they could only do it about 500,000 plus, because the situation is so difficult in a war-torn Gaza. And then even some of the volunteers were actually attacked. Some of the medical personnel got attacked during the war and they got hurt. But I'm sorry to say that today, the number of the endemic countries, which are only left with Pakistan and Afghanistan, they have increased number of polio viruses.
Mm-hmm.
In fact, in Afghanistan today, they have
Oh.
22 cases of infection, and Pakistan they have 28. So bringing a total of 50 from these two endemic countries. So in the world, there are only two endemic countries left with polio, which is Afghanistan and Pakistan. And today, the numbers of cases are 50. Last year, they only had 14. And the year before, they had 30. So we are very concerned about this, and everybody is actually looking at what went wrong and what could be done to prevent this. Again, as I said, various factors came into the picture that caused the rise in the numbers. However, having said that, the circulated vaccine-derived polio virus is reducing. In fact, in 2022, we had 26 countries with 914 cases of circulated vaccine-derived polio virus in 2022. In 2023, it was reduced from 914 cases to 524 cases. And the number of countries dropped from 26 to 23. In 2024, as of now, the number of cases from 524 last year, it came down to 185. So it's a big drop. And the number of countries also have dropped from 23 last year to 17 as of today. So what is more concerned is the number of increased cases in Afghanistan and Pakistan. Again, political situations, the infrastructure, accessibility to those children that we were supposed to immunize and we miss them. These are all factors. And in fact, to help the volunteers not miss any houses or any children, they are now using GPS, global positioning system, to track the houses that they are supposed to visit to give vaccine to these children so that they don't miss any children. Over to you.
Yeah, with that success being mentioned, and on the other hand, there needs a scale of resources. What have been the financial implications and the impact of donations, Andre?
Okay, for the benefit of many Rotary members and as well as the public, the money that was raised by Rotary, the 50 million, and then matched with 100 million from Bill and Melinda Gates Foundation, altogether 150 million, will be actually sent to GPEI. And it is this GPEI that will determine where the money is supposed to be channeled and for what purposes. But for your information and for the benefit of many Rotary members, Rotary is not the only entity that is raising money. We also have Bill and Melinda Gates Foundation who are giving money directly to GPEI. We have countries that are actually contributing. So there are many, many donors. Of course, if you look at Rotary, Rotary is one of the consistent donors year after year. But we are not the only one. So there are many, many parties, including children, and including countries. And the recent case is the Canadian government. They are actually injecting money towards this polio eradication.
Well, in this case, can general public or individuals, viewers contribute to the End Polio Now initiative?
Of course, they can do that. And in fact, the easiest way to do is to link with a Rotary member And in fact, to get the Rotary member to publish the QR code where they can actually donate money, in fact, you just go to rotary.org/donate, right? And you will be able to get into the website for you to be able to donate as not necessarily as members of Rotary, but as well as non-members, the public. So any contribution, any amount is very much appreciated. Over to you.
World Wide Web, rotary.org/polio.
No, /donate.
Donate. All right. World Wide Web rotary.org/donate.
Yeah.
All right. What would be the long-term benefits of a polio-free world?
Wow, I tell you, I can never imagine when that will happen. But if it does happen, and I'm confident one day we will actually reach that particular situation. You know, this is just like a marathon. You know, when you're seeing the finishing line. So what do you do? What do you do? You don't give up. You will run faster to reach that finishing line. And by having been successful in eradicating polio from the world, we are giving every child a bright future, because the polio virus destructs the life of a child and actually crumble the future of these children. And as we all know, children are actually leaders of tomorrow. So it is our responsibility. We cannot be selfish to make sure that we give that future to all of them. And yes, this is the website. You click on it, right? You click on it, and then you will be able to use your credit card to give to the Rotary Foundation under what we call it Polio Plus. And for the benefit of many Rotary members, okay, if you can just go down, scroll down, and you will be able to see Polio Plus. There you are, Polio Plus. You click Polio Plus, that box that says Polio Plus underneath the blue box. Yes, that's right. And you will be able then to enter your credit card information and just put in any figures, any amount that you would like to donate. This is something that we look forward to many members in the community to come and join forces with us, so that GPEI and Rotary will be able to strengthen the communities to eradicate polio. Over to you.
Dear viewers, ladies and gentlemen, together we can change the world. Time flies. We have come to the very final part of our talk. Frank and Andre, will each of you please leave with us one key takeaway or final thought in 1 minute each, please? Starting first, maybe with Frank.
Thank you, Supan. Well, in conclusion, I think our commitment to eradicate polio is unwavering. Despite the challenges we face, through innovative fundraising efforts and community engagement, we continue to make significant strides in these global missions. Together, we can create a polio-free future, and I encourage all of you to join us in this important journey. Well, thank you all for your support. Over to you, Supan.
Thank you. Thank you. Andre, what would you say?
Well, as I mentioned just now, we are nearly the finishing line. We have been doing a marathon for many, many years, and we are seeing the finishing line. Why? Because we have eradicated polio 99.9%. And in fact, today, we have immunized 3 billion children. And we have saved children from paralysis totaling about 21 million. And it is our responsibilities as adults and as parents to give our children and even our friends' children and the children of the community a bright future, ensuring that the world is free from threat of polio, so that they will not be on crutches and they will not be crippled, and that their future will be brightened up because they will be our leaders of tomorrow. So please continue the journey with all of us to give this world a polio-free world and a polio-free future for the children. Thank you.
Thank you. Thank you. Thank you, our guest for this episode, Mr. Andre Suharto, Rotary's Regional and Polio Now Coordinator, and Mr. Frank Chuen Chan. Thank you so much. And thank you, viewers, for spending time with us. We welcome comments or questions on all social media platforms, and we'll try our best to get back to you. Visit us at Facebook page, Creating Magic with Rotary, to connect with us for our next episode on Sunday, November the 10th. And if you are interested in being involved in Rotary, whether on the donation or any other activities, service projects, or you want to know more about Rotary, do visit any Rotary Club near you or post your wish on the Facebook's or YouTube's comments or the inbox of the page you are watching this program from. Dear viewers, the world of communications has changed. Watch us at any time, from anywhere, and on any device. See you next time. Goodbye. Goodbye, Frank. Goodbye, Andre.
Goodbye. Thank you very much. Bye-bye. Bye-bye.
78,290,000 kids under 5 around the world. But what's so important about being 5? Well, children who live to age 5 are twice as likely to reach adulthood. That's why vaccines matter so much. For 40 years, Rotary and partners have delivered vaccines globally. Like here and even here, in your neighborhood and around the world, Rotary is ensuring children grow up safe from preventable diseases.